Hello, everyone, and welcome back to the Strength and Hormones podcast. I'm your host, Lauren Papanos, and today I'm super excited for our guest. I'm joined by Dr. David Allen. He is a doctor of Chinese medicine and acupuncturist, and he's going to be talking us through really the role of the liver and the kidneys, more from a Chinese medicine perspective, and what we can do to be able to support stagnation in these two very important detox organs. So, welcome to the show, Dr. Allen, and thanks for being here. Yeah, and we were just saying how your office is just down the street from where we're recording. So he actually is located in Cardiff, Encinitas area for anyone who's also local to the San Diego area. But why don't you give us a little bit of an intro to yourself and your background?
Sure. Yeah, I've been in practice for about 18 years. So graduated about 19 years ago. And I've been in practice treating adults, so women and men, and then I've been treating kids for a long time now. And I'm actually now almost exclusively treating kids. I recently shifted my practice just to focus on one thing. So that's been a lot of fun. I teach at the local college here, and I teach for a couple of colleges back east. And then I do a little bit of traveling to teach as well.
Very cool. And do you have kids yourself? Is that what perked your interest, or?
I do
Okay.
have kids. Yeah, I got a 5-year-old and a 2-year-old. But actually, it was my mentor was the one who kind of got me interested in all this. He was treating kids. So he would treat about 15 patients a day. And then on any given day, it would be about 2 or 3 kids. Mm-hmm. And then I was his assistant for the whole time I was in school. So then what would happen was I would go in with the family, and then he would tell me what to do, the treatments that he wanted done. And so then I would end up spending a lot of time with the family. And that ended up being kind of my favorite part of the day. Was just talking to the parents, talking to the kid, messing around and stuff. And that got to be every time a kid was in, I just got excited about it. Yeah. And that just sort of stuck with me. Mm-hmm. Yeah. And I was young. I wasn't even interested in kids. It just kind of, it was an accident, you know?
Sure. Yeah.
So
well,
now
there's something beautiful about them, right?
it is great.
Yeah, that's amazing. Well, why don't we talk this, we're going to do 2 parts to our conversation. And so this episode, we're really going to be focusing on the liver and the kidneys. And then the next episode, we'll go a little bit deeper into the kids. So I'm really excited to chat more about that too. But for the purpose of this episode, let's talk a little bit more about what is the role of the liver and the kidneys. Maybe you can explain to us from more of a Chinese medicine perspective how they play a role in the overall body function.
Sure. So Chinese medicine looks at the body and says, okay, there are these different systems, right? So then that's part of what we look at when somebody comes in and we say, okay, what's going on? Oh, I'm having trouble sleeping. Then we say, okay, what are the different symptoms around the sleep? What are the things that are going on? But then we're curious. We want to know, well, how's digestion? Because for all we know, it's digestion is the cause of the sleep problem. Then I might ask, okay, something like age. Maybe it's age-related sleep issues. Or I'll ask questions about stress. Maybe it's stress-related sleep issues. So for us, in sleep, for example, conservatively 6 causes of insomnia, sleep issues. And so what we do is then we're saying, okay, what are the symptoms and how does that tell me what's going on with the sleep? So there's all these different systems. So there's respiratory, there's digestive, there's these other systems. So then you get into what we call sort of the kidneys. And the kidneys really is, how to describe the kidneys? The kidneys are really almost like genetic health. Like it's like the health you were born with. It's that strength that you have that you don't even work for. Like it's like feeling like you're 20 again, where you could sleep bad and you ate Del Taco all day but you feel fine. It's no big deal. You digested it, your energy's fine, whatever. You don't notice. Kidneys is like the internal strength that you have that it's like youth. It's really that feeling of youth. That's what we call the kidneys. And so as what we call the kidneys, as that energy begins to wane over time, that's aging. So you lose that kind of strength. So then you have to start paying attention to sleep. You have to start paying attention to food. You have to start paying attention to all these things. And kind of what it boils down to is really almost like just resilience, just that internal strength that you have for no other reason than you just have it. And this gets into things like the kidneys refers to things like reproduction. So reproduction is just something that sort of happens to you that you shouldn't have to think about. It just works. Again, this is the kidneys. It's just something about internal strength. It's just something about your body. They just work all the time. It's this inherited strength that you have. So this is, so for us, if people have trouble, for example, with fertility, then we would say, well, underneath that is probably some kind of weakness of the kidney system, no matter what else is going on. So for example, when you treat fertility, then we say, okay, so a big factor in fertility is stress. So stress, and we're going to talk about this in a minute, but if the kidneys are strong, if reproductive strength is there, then it doesn't matter how much stress there is, you're going to get pregnant no matter what. It doesn't matter, because we all know these situations treating fertility where there's women out there who are doing everything perfectly. To your eyes, they seem perfectly healthy, but still just have trouble getting pregnant. And then there's patients of mine, friends of mine, who just, the way they live their life, you just shouldn't think they should be able to get pregnant, and yet they don't even think about it. For us, that's the underlying strength of the kidneys, just that ability for reproduction to work correctly no matter what. So that's kidneys.
Yeah. So is that, and maybe you can tell us a little bit about the connection more, but is this because of the proximity of the adrenal glands to the kidneys? Is that the connection?
It seems to be. Okay. So really where this all goes is some European translator learned about Chinese medicine and was like, oh, I guess that kind of sounds like the kidneys when they talk about it, because the kidneys also control urination, for example. And in Chinese medicine, they say the kidneys are located in the lower back. And so, yeah, this would seem to be. So when you're talking about things like the adrenals, then these kinds of adrenals, the androgenic hormones and those kinds of things, these very deep layer hormones, especially the ones that relate very specifically to reproduction, that's what Chinese medicine refers to as the kidneys.
Okay. Let's talk through the liver and how that maybe differs or where the similarities lie.
So the liver then is a different system in the body. And the liver is more subtle. It's like it's a trickier one to talk about. The liver relates to things like cycles in the body, changes in the body. So while the kidneys are what drives the strength of reproduction, so for example, for women, it's their menstrual cycle, just the ability to have one. That's kind of the kidneys just in the background, just driving reproductive strength. But the liver is what rules all the little transitions. So you go from bleeding to not bleeding to ovulation, all of those little stages. That is ruled by the liver. How you transition from one thing to the next thing to the next thing. So liver really rules, in a sense, changes in the body. How you deal with, for example, stress. So somebody says something to you that changes how you're supposed to do something, changes your plans. Somebody calls you and is like, okay, this has been canceled and now we're doing it this way. The liver, from a psychological standpoint, is how well you're able to weather that change. So it's physical changes in the body, so monthly changes in the body, but it's also mental changes and your ability to make transitions. So it's a certain kind of mental resilience that way. Whereas, for example, the kidneys, from a mental perspective, the kidneys is just pure drive. It's just some kind, they call it willpower in the English translation for this. And it really is just some kind of drive that you have just to be alive. It's sexual reproductive drive, just that feeling that you just want to reproduce. And you don't know where it comes from. It's just bubbling over. That's kidney strength. But liver is more about how you manage your life, how you manage changes, how you manage scheduling. So it's a little bit different that way.
Okay. So I can imagine then if someone is maybe dealing with like low motivation, then that might be a sign to look deeper into the kidneys. Or if someone, I think a lot of like moms I work with, they experience this a lot where it's feeling like very easily frazzled, where it's like they're, one little thing happens where their child, doesn't want to wear those shoes and has a fit. And then it's like all of a sudden their bucket overflows, right? Is that kind of what we're talking about as it relates to the liver?
It is. It's exactly that. It's your ability to kind of roll with the punches a bit, but the kidneys do play into this, because if you're tired it just makes everything that much harder, right? So these things work together like that.
Yeah. Okay. So outside of those more like behavioral things, what are some other signs that there's stagnation in these organs that for you, when you see a patient, like those body systems are lighting up, or maybe it's things that you're noticing physically within them?
So when we're talking about the kidneys, we're really talking about sort of a weakness of the kidneys. That's the direction that the kidneys will tend to go. And I was saying that earlier, that it comes down to aging a lot of the times. So when do people start aging? Some people feel like, I have patients who are in their 20s that feel old. They just feel they lack that resilience. They almost feel frail to some degree. And there may be fertility issues going along with that or not, but that sensation of just being like, I just don't have deep energy. I feel tired in my bones, deep in my body, something that you would expect somebody to complain about in their 70s. So kidneys is really about weakness in that sense. So, but again, when somebody starts to complain about it, that's your inheritance. That's how strong were your parents. When the parents are strong, the kids tend to be strong. So I have patients where the parents are quite a bit older. So maybe the inheritance isn't quite as strong there. So they're complaining about that. So for the kidneys, we're really just talking about, are you strong or not? Like when I was saying resilience, for example, when let's say you get a little fever or something like that, so you're sick, you're kind of down and out, and, it's like when adults get fevers, it's unpleasant and it can take a few days to recover from that. One person might bounce back quite quickly from that. Another person, they might be laid out for a week after they're better, and it just zapped all their energy. Two people could go and work 12-hour days for a week, and one person just kind of bounces back from that after a weekend of resting, and the other person just doesn't. This is kidney strength, so then rebuilding that, and this becomes the question, how to do this. So that's one side of it.
Okay. And then how does that differ to stagnation that you see with individuals that are more liver specific?
Yeah. So then the liver, the problem there is more when we talk about kidneys, for example, we're saying like, look, this is about motivation, just deep down motivation, right? But liver is more about like irritability and sort of anger and that kind of stuff. So then regulating those emotions and all that kind of stuff. So that's where that comes up.
I see. Okay. So I think that this comes back to Chinese medicine, but correct me if I'm wrong. But there's like this old idea that if you wake up between the hours of 2 to 4 a.m., that's like the liver hour. And that potentially means that your liver needs additional support, or your body's like busy detoxing. Can you tell us a little bit more about that? And is that valid?
Yeah. So talking about liver stagnation, right? So we're saying, okay, what does this mean? This word stagnation, when we talk about the liver, what we're talking about is everyone is having this experience all the time, which is this feeling that when, let's say, for example, you get irritable about something, the experience that you're having when you're irritable is specifically the experience of kind of clenching up, like, like if you asked an artist to draw somebody who's angry, it would be this kind of caricature of clenching and muscle contraction. Everything kind of tightens in and clenches in. Chinese medicine has this notion that everything should be flowing all the time. And this is not so different from Western medicine. It's just a different languaging about it. So the brain is sending signals out, these electrical signals out through the system. The blood is flowing from the heart out into the periphery. Everything, the lymph nodes, everything is flowing and moving all the time. So when we talk about stagnation, we talk about something that mentally blocks you up, like that. But that has a downstream effect physically. Right. So this is where then this stagnation question comes up, where then it starts to create, in a sense, a lot of the way that I think about this is through the perspective of sort of muscle contractions. And that when you clench up like this and you have muscle contractions, that's not just happening in muscles you control, that's actually happening internally as well. So then, for example, we have issues where high blood pressure, right? So the heart is working to push blood throughout the body. And the harder the heart has to work, that's what we call high blood pressure, right? So what can happen is in the same way that when you get irritated with somebody and you clench up like this, the arteries leaving the heart are made of muscle, of course, and those clamp down as well. So now the heart is pushing against this relatively narrowed artery, and the heart is working really hard. It's just a stress response. So when we talk about stagnation, we talk about blockage of the system, and the whole system just clenches up. Like there's a million. A good example of this is stress-induced asthma. Same problem. So somebody experiences something stressful, they get a little anxious about it, but that particular person's response to that is that the accessory muscles of breathing, as well as the airways inside the lungs, all of this is muscle. And those muscles then clamp down and they clench, and suddenly the person they can't breathe. They're not getting oxygen, they're not getting rid of CO2, and they start panicking. And again, it's just that muscle contraction that's occurring, but for that person, it's occurring inside their lung tissue. And everyone in the world who is experiencing what we call liver stagnation, this response to stress, everyone's having that effect somewhere in the body. The question is where. So, I get a lot of kids with asthma. I've seen a lot of adults with asthma, and typically stress is some kind of component of that. It's not always the primary thing, but it's something that's going on there.
Mm-hmm. So are you saying that stress is what's driving the liver to be overactive in the hours of 2 to 4 a.m.?
Yeah, so technically it's 1 to 3 a.m.
Or 1 to 3, thank you.
But yeah, so what we think maybe, to sort of think about this, then we say, okay, so during the day, a person is walking around and they're all clenched. The way that we would probably translate this into Western medicine is probably through the perspective of the sympathetic nervous system. Right, the fight or flight response. So people are spending in modern culture a lot of the day just kind of clenched up, just got to get to the next thing, to the next thing, to the next thing. So the nervous system is just in this heightened state of hyper awareness, always looking for danger, this fight or flight response. If you spend all day doing that, your body gets used to that. That's what we call this neuroplasticity question, right? So the more you do one thing, the more your brain is going to be wanting to do that same thing. So when you fall asleep and your body should be relaxing, well, instead of relaxing, your body actually kind of tenses up and it stays tense. So I see this a lot in kids and of course in adults, but in kids, for example, you get a lot of things like sleep talking, active sleepers, stressful dreams at night. A lot of kids getting that. The adults are getting the same thing. You spend all day and your body is just in a stressed out mode, whether you're recognizing it or not. Then you go to bed and your body just sort of stays clamped. And then for some reason, people always notice that, if they tell me, I wake up at night, every night, and then I'll cut in, I'll be like, 1 a.m. or 3 a.m. And they'll be like, oh, how did you know? It's always the same. It's 1 a.m. I wake up every night. Yeah. It's one of these strange things of Chinese medicine, but there's some connection to that timing. But what that tells me is that their nervous system is in this very heightened state of awareness, and they're not relaxing even when they're sleeping.
And is that potentially when there's a change in sleep cycles from I don't know if you know this, but is that when deep sleep changes over to REM sleep? And is that potentially why that nervous system can be more sensitive, I guess, at that time? Or, why is it that someone could sleep just fine from 10 p.m. until 1 a.m., but then all of a sudden at 1 a.m., that's when they're noticing that their sympathetic nervous system is causing them to wake up, right? It is interesting.
It's not entirely clear to me. There are some questions about sleep cycles and how long. There's a lot of people, it's 4-hour sleep cycle. So then you go through a certain cycle, and then right at that 4-hour period, it's you come up to a little bit of light sleep and then you go back deep again to enter another cycle. So then some people just up and then they're up, So it's not entirely clear to me exactly all the time, because a lot of people, they're entering deep sleep and then coming back up into REM sleep, going back down. But those timings aren't entirely always clear as far as how that always works.
Sure. Yeah. Okay. But that's something for someone to definitely start to pay attention to. That you're
saying. Yeah. If you're waking up at 1 or 3 a.m. every night, then it's something your acupuncturist is going to want to know.
Yeah.
For sure.
Yeah. Okay. And then, if someone is potentially utilizing a bunch of herbs and they're actually pushing more like lipopolysaccharides in different breakdown products through their detox organs, like their kidneys and their liver. Could this potentially be a reason why there might be stagnation, or are you saying that the stagnation is purely coming from more of like these behavioral type?
It goes both
Response.
ways.
Okay.
Yeah. So these sort of detox organs, the harder they're working, something's got to give, right? So I was kind of saying it before, when you're tired, you're way more likely to be irritable. Something's got to give. You can't be getting it from all angles and have everything be cool all the time. You can't have your partner in your ear and your kids running around like, crazy kids, and then be tired and then also be relaxed. It's tough, but if your partner's in your ear and the kids are crazy, but you slept well, you could be okay. Or you didn't sleep that well, but the kids are like playing by themselves and they're being cool, and then it can be okay. So if, for example, when I have patients who are doing detox protocols, so often they're much more irritable during that time, and we have these things that we say about that. But in Chinese medicine, you're putting your body under stress when you're doing that kind of stuff. So that's why for us, in general, when we talk about detoxing, we would say, well, in a funny way, the best time to detox is kind of when you're at your healthiest, when you're at your best, and then you can kind of put a little pressure on the system. You can kind of push yourself a little bit. It's funny because most people think to detox when they're at their worst. It's like, oh, maybe I'll detox and then it'll spring me back. But a lot of the times what I notice is that it doesn't end up working out that well. And so, yeah, I mean, when the body's under pressure, the brain will follow.
Yeah.
Yeah.
And that's such a good point, because I see that a lot where I have patients that come to me and they've worked with a lot of other functional providers, and they've just instantly put them on herbs because they see like in their stool analysis that there's overgrowth of bacteria or that they have mold. And so then they just start to probe these different, toxins, but the person doesn't have the capacity to detox, right? Because they're so depleted. And especially like women that are postpartum, they've just depleted so many vitamins and minerals. And so I'm always preaching to them how important it is that we replenish the body, replenish reserves before we look at pushing these organs, because if you do that, it will backfire, as it sounds like you're alluding to.
Yeah, I mean, this is exactly a Chinese medicine perspective on all of this. Because if you look, for example, at an herbal formula, like let's say somebody comes in and they have bacterial overgrowth and they have inflammation in the gut and all these things, a Chinese medicine formula will look to kill off that bacterial overgrowth. It will look to clear that inflammation as much as possible. But at the core of that herbal formula will always be something that's strengthening digestion. It would have to be almost an emergency situation for an herbal formula in Chinese medicine to not have something that's strengthening in there as a way of support. So Chinese medicine likes to do two things at the same time, but there's always going to be that support in there to make sure that you don't get those negative reactions that you might see.
Yeah, tell us a little bit more about Chinese herbal formulas and how they're formulated, because I typically don't use more Chinese herbs. I will utilize singular herbs like, maybe berberine, oregano, and things. But I have seen different Chinese herbal formulas. They look very different than, just traditional herbal formulas. So what exactly are the different types of like plants? How do they differ from what are some other types of herbal formulas? And maybe you can tell us a little bit more about what's typically in them that's different.
Sure. Yeah. I mean, you look at so you have herbalism from India, for example, Ayurveda. You have Western traditions of herbalism, and what's interesting about both of those traditions is, as you said, they tend to use just kind of one herb at a time. So in both cases, they might say, "Oh, there's a cough. So I have this herb for cough, elderberry or something that's good for cough." Or, oh, I have sleep issues. So we have this nervine, this chamomile can be good for that. But Chinese medicine would say, look, you have a cough, but what's the cause of the cough? What kind of cough are we talking about here? Is this a acute cough or a chronic cough? Is this a wet cough or a dry cough? Because, for example, like let's take the wet cough versus dry cough question. A wet cough is going to be something where there's actually mucus proteins building up in there, whether it's an acute or chronic situation. There's going to be these mucus proteins building up in the lung tissue. So in that case, the herbal formulas are going to have probably some kind of enzymatic action where you drink the herbs, those enzymes enter the bloodstream and then go and they track directly to the lung tissue and help to break down those mucus proteins in there. Whereas for example, though, if you give another patient that same formula, but they have a dry cough, where are those enzymes going to go? What are they going to be attacking in that situation? What are you trying to break down in that situation? Those enzymes might end up going and attacking good, healthy tissue. And in that case, and this is what Chinese medicine would say, in that case, if you give wet cough herbs to a dry cough person, there's a good chance that dry cough's going to get worse. And so this is the kind of differentiation that Chinese medicine makes, that makes it so special, is all of these different questions. Because an acute cough versus a chronic cough, again, these are two different questions. Because you have inflammation that can be acute inflammation, and that's a whole class of herbs that are designed to deal with acute inflammation. Then there's a whole other class of herbs in this situation that are chronic inflammation herbs. And Western medicine doesn't necessarily always differentiate between these kinds of things. It's just sort of inflammation. I mean, in one case you might use antibiotics in a more acute situation, and you might use steroids in a more chronic situation. Right? But Chinese medicine really thinks about this in a very granular way and says, okay, look, again, here, conservatively with cough, there's 6, 7 different causes of cough. And they will have wildly different formulas for each of the types. And there might not even be all that much overlap between the different types. And the training of Chinese medicine is to know which formulas to give at which times, and then how not to exacerbate somebody's condition by giving them the wrong herbs. So this is where Chinese medicine gets really nice like this. It's the same type of herbs that you're going to see in Western medicine, leaves and branches and barks and roots and all these, things that just look like street sweepings if you don't know. But whereas in Western herbalism, maybe one herb they give, Chinese medicine, it could be anywhere from 6, 7, 8 up to 15 herbs, all in one formula, and each herb doing something very specific. So you might have in any given formula, you might have 2 or 3 that are working on the inflammation. For a cough, you might have a couple of herbs that are very specifically antispasmodics to stop that coughing. Then you might have something to clear out that extra mucus protein fluid that's building up in there. Something to break that down, something to strengthen the lungs generally. What does that mean? Maybe we're pushing more blood flow into the lung tissue, get better delivery of the immune system into that area. Right? So then maybe another part of that formula is something to boost the immune system, right? So then it's sort of lining those things up and trying to hit all those things at the same time. Then what you tend to see when you get it right is the symptoms just tend to clear fairly quickly depending on what's going on.
Wow. It's like an orchestra.
Chinese medicine is very elegant in that way. It's really quite beautiful.
Yeah, it sounds more complex, but for good reasons. And I love that there's kind of an order of operations, it sounds like. So that's amazing. So on that note with order of operations, let's talk through the kidney and the liver. So a lot of my population, a lot of listeners that are listening to this podcast episode, they are women that are experiencing either thyroid or some type of reproductive hormone imbalance. And so a lot of them may have some of these symptoms that you're explaining, both the, lack of motivation, the fatigue that it sounds like is more kidney derived, but then also more of these cycle fertility challenges, thyroid challenges, which I know is very connected to the liver as well. So where does one start? If someone's dealing with all of that at the same time, like, is this a kidney and a liver stagnation issue happening together? Or from your perspective, do the kidneys need to be supported first? And what would be the best route to go about that?
This is a nice question. Go find your local acupuncturist
Sure.
first of all, but so the way that we think about this is you have a certain amount of energy, and stress draws off that energy quickly in a certain sense. I mean, it's a slow roll. It takes a long time for you to really notice it. But the thing is when your body's in a stressed out mode, in that sympathetic fight or flight mode, it's just eating energy from your body. I mean, it's just a colossal waste of energy in a certain sense. Unless you're in a situation where you need to stay alive, you're driving or something, you got to be very aware and acutely aware of things. Outside of that, That's a total waste of energy to have your heart beating at a very high rate, to have your brain using, lots of glucose, to have your liver dumping glucose. And so it's not, this is a total waste of energy. When you're stressed out, your body stops immune function, it stops digestive function, it constricts all the blood vessels to the digestion and stuff. So at the outset, Chinese medicine would say that really where this process begins is in fixing your mind, fixing your heart. And it's not always the most fun, it's not always the sexiest way to say these things, because it's like, well, isn't there an herb I could take? Yeah, there are totally herbs you could take that would build up your internal strength and make you feel stronger. The problem there is you're just going to waste it again. You're just going to burn through that too. And then you're just going to end up with other problems. So the herbs are mild, but it doesn't quite work like that, So Chinese medicine would say that it's again, this isn't so sexy, but it's that balanced lifestyle that really matters here. And I think, though, that, it's so easy to say that, and we're surrounded by just the litany of people talking to us about doing these things. But I think Chinese medicine brings a fairly pragmatic view to this question in my mind, and it's something that I've learned over the past 20 some odd years working with this stuff, is like, for example, thinking about being stressed, thinking about the fight or flight system and the sympathetic nervous system. The way that works is via kind of a threshold system, in a sense. So your partner could say this many annoying things to you before you're going to flip out. This many people can cut you off on the freeway before you're going to flip out. And I mean like flip out, just have a reaction, just be like, rah, The more times you flip out, the lower that threshold gets. So the easier it becomes to flip out. So then pretty soon it's every little thing is sparking that little flip out that you're having, which is then when you do that, then your system falls into that. Then it's a whole cascade of chemical responses that occur there, right? So your adrenals are dumping, and it just all these stress hormones are going all over the place, and your neurotransmitters are changing and stuff. So then you're training your brain to do a certain thing, and then so pretty soon your threshold is so low that you're just constantly in this hyper state of awareness, and you're looking at everything through the lens of conflict, because that's what the fight or flight system is for, is to recognize conflict. Where is it? Where is it? Where is it? Right? So then the beauty of that, though, is that it's actually not that hard to kind of short circuit that system. And this is the really nice thing about Chinese medicine, because the thing that I learned, and the older I get, I think the more this is really coming home to me, which is the notion that your body is always trying to fix itself. That's like a thing. And it's like, it took me a long time to get that. I'm mildly a bit of a lump, so but it's like, that notion, though, is so interesting, because if your body is always trying to fix itself, then in a sense, you just need to give it a chance to do that, and things will turn around for you. And the beauty of that is that because the mind and the body are so intimately connected, the beauty of that is that your mind is always trying to fix itself. And it will fix itself if we give it a chance. So then the question becomes, what does that mean to give it a chance? So now here's the thing, is the reason that I've sort of thought about it this way is because it's what works for me, is this notion that stress and anger have this kind of clenching quality to it. I mean, it's kind of self-evident if you really just, So there's a little exercise that people can do, and the downstream effects of this are massive. I'm just amazed at how quickly this works to short circuit this entire system and to raise that threshold back up. And the beauty of it is, when that threshold starts to go back up, the way you see the entire world just changes. Like, you just perceive everything differently. It's like your kids are doing something that would normally drive you crazy, And you just see it differently. You're like, oh, it's a kid. Like, of course that's what they would do, So, okay, here's what worked for me. The next time that you get angry about something, in a sense, if you think about it this way, you have no self-control over getting angry about something. So somebody sends you a text you don't like, you have no self-control about how you're going to react to that in terms of your physical body. You see the text and then it's just like, But what you do have self-control over is how you choose to act in response to that sensation. So you get angry about something, but then rather than just shooting that text back, and then escalating the whole thing into some crazy thing, this is where a little bit of self-control comes in. So this is like you're starting to kind of ramp up with your partner, or you're getting a little annoyed with your kids. Something is getting really irritating. What you do is you just separate yourself from that situation. You'd be like, I can't talk to you right now. I'm going to go. And you just go into the room, some dark room, close the door, and then just sit in the darkness. It sounds weird, I know. You just sit in the darkness with your eyes closed and you just breathe for a second. And just see how you feel. And you're noticing your heart's pumping and your mind is like, I'm right and this is not good, and all this stuff. And whether you're right or not, it's not the point. What we're doing here is we're short-circuiting the brain by just letting the thing run its course. Because essentially anger is basically just a chemical process. It just dumps a bunch of hormones into this, a bunch of neurotransmissions, a bunch of stuff, chemicals get dumped into the bloodstream. And now you just are, your heart is beating and stuff like that, and your brain is responding to this. If you just stop for a second, what's so interesting about this is you watch that anger rise up, and then in the darkness of your own bedroom where nobody's there to annoy you more, if you just kind of let yourself feel how you feel, if you just give it a couple of minutes of just sitting with that, it's like you just watch that chemical cascade just wash through you. Like it's like a wave. It just comes and it's big and it can be 10 miles wide and a mile high and it's just coming at you. And then you just sit with it for a second and it just washes through you. And then you can just watch it trail away, and your heart starts to slow down and everything just kind of calms down. And then you're suddenly sitting there going like, okay, suddenly you have some perspective on your situation. And then you walk back outside and you're like, okay, I didn't like how you said that. I see why you said it, but I feel like also you're kind of trampling on me here a little bit. But I think I see both sides now. Can we have a civil conversation about what's going on here? Right? So it completely changes exactly, number one, how you're going to end up dealing with the problem. Every study will always show that doing anything, like making any kind of decision when you're angry or stressed, is always the worst idea. It's unequivocally, it's a bad idea to do that, no matter how good it feels. So that's where a little bit of self-control comes in. Separate yourself from the situation. Just kind of sit with your anger for a minute and just watch it. And then just watch it go away. And then just feel kind of normal after that. And then you have perspective on your situation. Then it's like, okay, I understand why I'm angry, but now I see why the person did that. And it doesn't matter, again, who's right or wrong. At least then you're in a position to actually work something out rather than just scaling it up all the time. The real beauty of that simple practice is that what's amazing for me in my life is the downstream effects of that. Because what you've done in that exact situation is, rather than shooting back the text or yelling at that person or something like that, which would lower your threshold, you did something that dramatically raises that threshold back up. And when that threshold is back up, it changes the chemicals that your brain is operating with, which changes how you see the world. It's not something that you have to work for. It's by having a little self-control in one spot, the brain fixes itself in other spots. And then you just start seeing the world differently. And then so you start responding to things differently. You just feel happier, you don't have to yell at your kids so much. You don't have to be irritated all the time. And what's so beautiful about that is it starts to replicate. It starts to self-reinforce, because then your threshold is higher. You're not so annoyed. You now have better skills for dealing with things. You're a little more patient, and so it reinforces itself. It reinforces itself because you just see the world differently. It's just automatic. You don't even think about it. You just catch yourself being like, I normally would have been annoyed about that, but suddenly I'm not. This is cool, and then you're kind of just sitting there like, what do I do with myself now? I got all this time on my hands, where normally I'd have been mad and now I'm not. So then the beauty of that is, when you're not wasting all your energy being angry all the time because your body's working overtime to be mad about something, then you're giving your body a chance to rebuild itself. Because I'm sure you well know, it's like when people come in with like adrenal fatigue, you can't just give them adrenal supplements and watch them get better. It just doesn't work like that. They could take high doses of adrenal supplements. They're going to have all these side effects, and they're going to insomnia and anxiety, and they're going to be irritable and all this stuff. And then they stop taking it and they don't feel any better than they did. It's a relatively slow roll. You would, for adrenal supplements, you might take a very small dose over a longer period of time. Herbs like, for example, ginseng or ashwagandha or something like that. These rebuild reproductive strength. They rebuild that deep genetic strength that you were born with. These herbs rebuild that for you, but it takes time. So what you do in that situation is you take small doses over a long period of time, while at the same time you're getting rid of your stress by having a little bit of self-control. And then over time, you just notice that you're a different person. You don't even recognize yourself in a certain way.
Yeah, I agree with that. It's both have to happen simultaneously. And I think sometimes we want to only look to the physical for where we can fix our symptoms, right? But there is so much of this psychological piece to it. And so it's kind of this push and the pull of kind of doing both at the same time to be able to find that place of balance again. Yeah.
Yeah, another thing that's interesting with Chinese medicine, and this comes to sort of your wheelhouse more, which is the diet question, right? So then Chinese medicine would say, and this is an interesting perspective that Chinese medicine brings to digestion that I don't hear anywhere else, except from you guys, is this question of what we would call kind of like digestive efficiency or something, right? So this question of, look, you can eat as much food as you like, but your digestion can only digest a certain amount of that at a time, right? It can only make so many of those nutrients available to your system at any given time. So for people who are trying to rebuild their system, that's where diet becomes so important, right? And so we would say, of course, so digestive efficiency. So we're talking about things where, of course, avoid foods that you don't need because you're wasting energy. Eating chips, very minimal nutritional value. They're very dry, so they're stealing fluids from the body in order to digest these things. Then you're going to go and be like, oh, I'm going to eat a really healthy dinner and stuff. It's like, you can't digest all these things. There's a limitation to how much you can digest, right? So Chinese medicine then would say, okay, what's really interesting about the way that the body works is, for example, you have basically like if we took all the blood out of somebody's body and put it in a jar, right? That's the blood you have. That's your volume, right? So the question is where does that come from? It comes from your digestion. Your digestion, you ate food, you drank water, your body will convert that food into blood plasma. Just the basics of blood plasma, like just this liquid portion of your blood, like that I have now in this jar, your digestion made that, right? So now if you think about what constitutes aging, like if you think about aging, like what is that? It's, if I asked an artist to come in and draw a caricature of somebody who was older, right, an elder patient or something, what would be the first thing they would probably try to do? They would try to draw in some wrinkles. If they could, they would draw in some dry skin or something like that, drying hair, right? Everything kind of drying out and shriveling up. Well, think about it. Like, what's the difference, for example, between a grape and a raisin? Just water. This is the only difference. It's just a fluid difference, right? So essentially, that's how Chinese medicine views aging. Is it's your blood supply is what is able to support all of that activity that you do, and your digestion makes that blood supply. So if you're constantly stressed, your basic fundamental strength isn't there anymore. Your digestion can make up for that by making more nutrition available to you, by making, this blood volume. It keeps your blood volume up, which is what keeps you healthy. But as you age and you're losing this blood volume, we say that for women around after 35, for men after around 40, digestion begins to decline. So we're talking about, this is in Chinese medicine thing, is stomach acid production begins to decline, pancreatic enzyme production and release begins to decline. All of these different processes that we associate with digestion, they start to decline. And so then as your digestion declines, your ability to make new blood and keep yourself full of blood as a nice little grape that we all want to be, this begins to decline over time. And that the problem there is that all your blood volume will first go to your brain, to nourish your brain. Whatever's left over from that process goes over to the internal organs to keep them nourished. Then whatever's left over from that process goes out to the periphery, right? So then that's when you start to get joint issues. That's when the dry skin starts to come out. That's when the dry hair starts to come out, all of these things. That's when the wrinkles come out. You're losing that fluid. So Chinese medicine would say, look, if you're living a life where you're constantly stressed, your heart is working, your muscles are staying in a high state of readiness, you're using up your blood. The blood is like this gasoline for the, it's like keeps everything sort of strong, and it nourishes everything, and the blood has all the nutrition in it that you need, but you're just burning that up as you go. So you have this piece where it's, you want to try to get rid of your stress as much as possible. You want to try to build up this fundamental strength. But then the third piece really is this digestive question, right? And that's not so sexy either, to talk about diet and stuff. Everybody's talking about diet, but it's so important, because you can drink water all day, but how much of that are you peeing out? Is your body really converting all that water into new blood? It's not. Because there's a problem of digestive efficiency. If your digestion is super strong, you could drink water and then you'd be robust, full of blood, and you could be 90 with no wrinkles or something. That's just not how it works, right?
Yeah. Well, thank you for providing all that context around the connections between stress and how it impacts the liver and the kidneys and how our body detoxes. And I think that the take home here is how important it is to look at the mental burden of our life alongside of the physical burden, and that before we look at modifying, detox or supporting our detox organs, we need to make sure that the body has the capacity to detox, and that we are also thinking about stress and the nervous system and how those play a role in our ability to heal. So thank you so much, Dr. David, for providing that. And for listeners who maybe aren't familiar with your practice, could you provide us the name? And I provided that it was located in Cardiff, but for those that maybe want to learn more about you, where you're located online as well.
Sure. My website, davidallenlac.com. I'm easy to find. I'm in the greater San Diego area, of course. And my practice is called Healthy Kids Acupuncture, again, mostly treating kids. I do take some adult patients on just for telehealth herbal consultations to some degree, depending. I'll also refer out. So if people need referrals or something, I'm happy to provide that. I do also provide sort of meditation instruction and stuff for these kinds of things, because that's what this conversation in a sense comes down to, is like, meditation and all these things. And it's nice to make it practical and relatively easy, rather than some very highfalutin, like you have to sit, it's not. It's pragmatic ways to incorporate this stress reduction into your life, how you can pragmatically and practically step in and reduce that in a way that's actually so fast. Yeah, you do it once and you just, for weeks, you notice the difference. It's quite amazing. So yeah, I'm available for conversations with adults, and always.
Okay. Yeah. Great. And we'll put all that information in the show notes below. Thank you so much.
Right, of course.